Hello, I'm Rebecca, Eden's pharmacist, and also the Vice President of Pharmacy Operations, here to serve you. Today, I'm going to guide you through the safe storage, drawing up, and administration of your weekly semaglutide injection. First, let's talk about storage. Upon receiving your semaglutide, it is necessary to keep it refrigerated between 36 and 46 degrees Fahrenheit to maintain its effectiveness. It is okay for the product to arrive warm, but to achieve the intended shelf life of the product, please move it to the refrigerator until you're ready for the first use. Remember to always read your prescription label before use. Ensure that you have the correct medication at the correct dosage that your doctor prescribed. Also, check the expiration date. Do not use any medication past the BUD or beyond use date. After your first injection, remember that you have 28 days to use or discard the contents. Now, let's move on to the injection process. Note that this medication is to be injected subcutaneously, so just under the skin in the tissue before you reach the muscle. As we go, I'll show you the milliliter or ml to milligram ratios at each step. Prescribers typically follow a dosing schedule like this. For month 1, first 4 weeks, inject 0.1 ml per week, which is 0.25 milligrams. On month 2, weeks 5 through 8, inject 0.2 milliliters per week, which is 0.5 milligrams of semaglutide. On month 3, which is weeks 9 through 12, inject 0.4 milliliters per week, which is 1 milligram of semaglutide. On month 4, weeks 13 through 16, inject 0.68 mLs per week, which is 1.7 milligrams. Month 5 and moving forward, inject 0.96 mLs per week, which is 2.4 milligrams in the highest recommended dose. Before each injection, ensure your hands are clean. Sterilize the injection site on your abdomen or thigh by wiping it with an alcohol swab. Also be sure to clean the vial's rubber stopper with an alcohol swab just prior to use. Check the syringe packaging to ensure that it has not been opened or damaged. Once you have drawn up your prescribed dosage, ensure that you tap the syringe while it is still facing upwards to remove any large air bubbles. The air bubbles will not hurt you as it is below the skin, but it may reduce the dose that you actually receive by taking up room in the syringe. Next, find a comfortable spot on your abdomen or thigh with fatty tissue. Ensure that the area is clean and you have no bruising, burns, swelling, or hardness in the area, and gently insert the needle. Now let me demonstrate with this sponge. First, remove the safety cap on the plunger. Next, withdraw the amount of air that is equivalent to the dose that you intend to inject. Carefully insert the needle into the rubber stopper. Inject the air. Begin withdrawing your dose. Be careful to remove any air bubbles. Carefully squeeze the tissue of your injection site. Insert at a 45-degree angle. Inject and withdraw. After the injection, it is unlikely that you will experience bleeding, but have a Band-Aid ready just in case. Remember, rotate injection sites. Lastly, store your medication back in the refrigerator, keeping it between 36 and 46 degrees Fahrenheit for optimal effectiveness. And remember, if you have any questions or experience any side effects, don't hesitate to reach out to the Eden team or your healthcare provider. That's it! You now know how to safely store, draw up, and administer your weekly semaglutide injection. Thank you for watching, and congratulations on taking your first step in the journey towards optimal metabolic health.